Hi everyone. So today we are live with Dr. Aruna Kalra, and today we'll be talking about breast cancer. As you all know, October is Breast Cancer Awareness Month, and it's important that we talk about it because early detection is very important, and breast cancer can be fatal if not detected on a right time if the early detection doesn't happen and a lot more. Like in India, the number of cases of breast cancer have been rising. We'll know why the number of cases have been rising. What is breast cancer? Can you prevent yourself? What are the tests that a doctor recommend so that you can detect breast cancer at an early stage? So we'll discuss everything with Dr. Aruna. So hello, Dr. Aruna. How are you?
I'm good, all good, and welcome everyone. Let's hope that this is an interactive session and you gain a lot of information from here today.
Yeah. So, Dr. Rana, let's just like maybe start with the basics as to what is breast cancer, what happens in breast cancer.
Okay, so as we are aware and we are scared of the word cancer uh, because it is a cell or a type, some part of body which starts growing without any hindrance or without any stoppage. So when it starts growing beyond its boundaries and it starts eating up other organ systems, it is called crab or cancer, which is synonymous of crab. So breast cancer is the cancer of breast arising from the breast tissue, and when it starts developing, it starts either showing towards the skin, like skin covering the breast, or it erodes underneath muscle or bone, and it starts spreading elsewhere. So breast cancer is the cancer which originates from breast.
Okay. So, and why do you think there's a rise in the number of cases in India?
Okay, so there are few high risk conditions in which breast cancers, we feel that it is rising nowadays, and those high risk situations are uh, breast cancer is mostly a hormonal cancer in which if uninterrupted hormone is acting on female's life, uh, like estrogen is there all through her life without any interruption with progesterone, chances of breast cancer are high. So what do I mean by that? अ, पहले ज़माने में जैसे अगर किसी ने 3 बच्चे किए या 2 बच्चे किए, so during those pregnancies there was a pause. Estrogen would go down, progesterone would be more, and then once you feed your baby during lactation, again prolactin would be high and estrogen, progesterone would be low. So these are pause times when breast is uh, uh, protected from uninterrupted estrogen action. Okay, nowadays we do not conceive that early in age. Menarche age is, or the first periods age of girls is decreasing. Like we used to we got our first periods at around 14, 15, or 17. But nowadays girls are getting as early as 10 or sometimes 8 or 9. And then menopause age, if it is 55 and beyond. So years of estrogen exposure is increasing, and that also increases chances of breast cancer. Late pregnancies or single pregnancy, that also increases exposure to estrogen throughout life, or obesity, again smoking, alcohol, all those things, because everything is, lifestyle is changing, and all these things are contributing to rise in breast cancer.
Okay. And how common is it in India now? Like we know that, like, do you have any number in mind that you can share that how common is it in India?
So I would give you one example. Like previously, we used to say that uh, breast cancer is a cancer of older generation. So, but nowadays we see girls as young as 20, 25 who are coming with breast cancer. and it is as common as like next to cervical cancer is the cancer of mouth of the uterus, uh, and in near future, I we believe that every like seventh person would be breast cancer, would be suffering from breast cancer, which is quite high a percentage.
Okay. So, Dr. Na, can you tell us like a few symptoms of breast cancer? Like if someone, anything that, any changes that we see in our body, and then we know that, this is a sign of breast cancer.
So how would we get to know until unless we do not know how to examine our breast? Okay. So one thing is that everybody should examine uh, their breast in front of mirror while they are showering, while they are having bath. So first thing is seeing whether both the nipples are at the same position or not. If one nipple is pulled up or another is pulled to one side or something, it means some underlying lump is pulling it. If they should be at the same level, nipples should be at the same level. Then outside skin should be normal looking. So if it is looking like an orange peel appearance in which there are some dimples, it means something is pulling all the fibrous structure inside, and there is dimpling of skin, which is called orange peel appearance. And if there is some rash or some kind of pimple, you feel that it's really itchy, and every time you apply some over the counter drug to cream to heal that, but it comes back again and again. So one unhealing ulcer or pimple, which comes back after that application of that cream, can be again underlying some lump is growing or cancer is growing inside. If nipple is pulled inside, if it is retracted, it was normal before, but now it is getting pulled inside, again is it can indicate that some lump is putting it inside, and these are only by the look of it we can see. We have not even examined our breast yet, not even palpated it as yet. So once we have stopped our menstruation, like post menstrual cycle, post periods, we should examine our breast, with both the hands. And how we should be palpating is like we should lie down on bed, and our breast should be supported on chest wall, so it should not be hanging towards one side, and like it should be supported. And then you should not palpate your breast with tip of finger. This should not be the way to palpate your breast. You should always be with the flat of hand. You should always be palpating breast tissue between two flat of hand. So this should be the area palpating. And if we feel with the flat of hand, we feel that only hard lump we can feel. But if we start feeling with the tip of hands, every gland would be felt like a lump. So if we felt something with the flat of hand, between flat of hand, we have to see whether it's mobile. So mobile hard lump can be fibroadenomas, or also called breast mouse. Every lump is not cancer. So once you are suspicious, you should go to doctor and ask her to examine your lump. Sometimes it might be very small, and patients are very very intelligent. They can examine their breast better than doctor, and sometimes doctor miss and patient says no, it is there, just see. I have felt many a times. And then we try to see whether it is fixed from below, or it is fixed to the skin. So anything which is fixed to underneath or above skin, we are suspicious that it might be either infection or inflammation, or some kind of precancerous or cancerous growth. So after we do examine our breast every month post period, only then we are aware whether this is my normal breast and this is something new which I am palpating now. And if you have family history of breast cancer, definitely you should know how to do breast examination and what are the signs. And like everybody should know, as we said, that as early as 20 years old girl is prone to develop breast cancer because of unhealthy dietary habits, unhealthy otherwise life choices.
So, like, I was about to ask that, like, does heredity play a role in this? Like, if the mother has a breast cancer, then the child can also get it. What are the chances, basically?
Okay, so yes, if mother or your masi, like aunt, maternal side aunt, or your sister, uh, if if this kind of maternal history is there of breast cancer or ovarian cancer, or sometimes in father colon cancer, it runs in the family because it is carried by a BRCA gene, which is BRCA1 and BRCA2 gene. And if we have such kind of history in our family, then we should get ourselves checked for these genes. And if it would have been better if those cancers were also checked whether they are BRCA positive or not. And yes, there are chances that if you have a family history, you are more prone for these kind of genetic breast cancers, and you should get yourself checked yearly for that.
So
Ovarian and Mhm.
yeah, so you just mentioned that you we should get ourselves checked if there's a history. So what are like there's self-examination that we can do, but are there any specific tests that are recommended by the doctors? Some names that a woman should get that test done once a year or twice a year. Uh,
Mhm. Okay, so breast self-examination is the best thing which we should be doing. Then, when you go for pap smear every year, whoever is sexually active, they should ask doctor, and they should always go post-menstrual, and they should ask doctor that, okay, please do examine my breast. And this is called breast examination by clinician. So every year, if you are getting breast examination by clinician, that it gives more clarification whether there is some lump, and then and there we can do further tests to detect any possibility. And third would be if you are younger than 40 years of age and breasts are dense, we go for breast ultrasound for any suspicious lump. Okay, but if you're more than 40 years of age, we recommend mammogram every year for people who have family history of breast cancer, but who do not have family history. Yearly mammogram we do not recommend, and then we say that okay, if two consecutive mammograms were normal, you can go for after every 3 years to reduce the risk of radiation. And same way, if somebody is less than 40, but ultrasound also does not show some, like cannot confirm, then we should be going for MRI breast. In those cases, when we cannot do mammogram, or mammogram would not show good diagnosis, it won't be able to diagnose because of denser breast, we should go for MRI.
okay, okay. Can we actually prevent breast cancer? Like, are there any ways, like you mentioned in the start, that the lifestyle has changed a lot, and because of that, the number of cases have been rising. So, is there any way in which we can prevent ourselves?
So it starts from very early years in life. Why kids are getting early menarche are mostly on junk food. Uh, so if girls are on junk food, low carb, low fiber carbohydrates, they are more prone to gain weight. Uh, Physically, girls or kids are not physically active, and that also increases the risk of
Hi, can you see me?
Hello, can you hear me?
Yes, yes, I can.
Okay, so as I was saying, that unhealthy dietary habits and no exercise or no games make them prone for higher BMI. They are getting obese. boys and girls both, chances that they would get early menarche are high. And we want them to get their periods at somewhere around 14, 15 years of age, not as early as 10. They are not even mature mentally to handle the periods. And then we would not say that okay, early marriage is, it would be better. That previous scenario was so much better when we were getting early pregnancies and um, uh, two pregnancies or three pregnancies, two or three kids. But I don't think it's practical for me to say that you should get pregnant or get married at the age of 22 or something. But yes, we can maintain a healthy lifestyle, because other lifestyle choices like having alcohol or smoking can affect our health. Breast cancer is one thing, and PCOD is another thing which can, which is a causative factor is smoking and alcohol. So we should avoid that. Too much of hormonal pills which we pop like morning after pills after every sex, we think that it is a safer option, should not be done. And so these are few things. And then if, because we are not going for early marriages, early or repeated or two or three deliveries, we should be going for preventive health checkup every year to prevent that. I think more awareness should be there uh, for HPV virus vaccine, for breast examination, for preventive health checkup. Uh, Breastfeeding, if you are already have, like if you are in that reproductive age group, you're married and you have conceived, I would say that try not to make excuses not to breastfeed your child. Breastfeeding also protects you from breast cancer. So that would be one thing which would help you preventing breast cancer in the
Okay.
future.
Okay. Uh, Thank you so much. I mean, that's all I had. A few of our viewers have asked what are the symptoms and if we can detect it early or not. And I think we've already discussed that self-examination is important, and every year you can go to the doctor and get the tests done as well. If you feel like Dr. Aruna mentioned that not every lump is cancer, but if you feel that the lump, like if you're suspicious about the lump, please go and get it checked by a doctor. So, Dr. Aruna, if not every lump is not like cancerous, then what? Why do we have those lumps? Like, are they like what does the doctor do?
Okay, so see, breast is it has a lot many bacterial glands, fibrous tissue, and fat, and sometimes it would be, there would be trauma to breast, with say baby's head or somebody's elbow. That heals by itself by making a lump or fibrous healing structure, or sometimes there is a hormonal lump which is called fibroadenoma. So those are also called breast mouses, and those are not harmful. Mostly, if it is not troubling us or it's not big, we do not remove it. One thing which I missed was the nipple discharge. So if somebody is having some kind of like or watery discharge from one nipple, that is also should be shown to the clinician. Because see, breast milk discharge can happen to anybody who has ever breastfed their kids. But breast discharge comes from one breast, which is like clear water, greenish, or blood stain, can be suspicious. Sometimes many drugs also can cause breast discharge from both the nipples, which is like milky discharge. It is called galactoria. And sometimes you are having lots of anti-anxiety drugs, anti-hypertensive drugs. They can also cause milk from both the breast, or you are stressed, unnecessary prolactin level would be really high. So both breasts, if they are leaking and they are having white color discharge, uh, it is not serious. It is central. It can be because of some hormone, either because of high prolactin or because you are taking some kind of stress or medicine. But if there is breast discharge from single breast, from, and that is not milky, it is like color is different, reddish green. you should go to the doctor. It can be.
Okay, okay. Thank you so much, Dr. Arna. It was an informative session, and I hope people, like all the women out there, watch this live session and get some information about breast cancer, because it's important that we detect it early. It's easier to the treatment is easier if it is detected early. That's it. Thank you so much, Dr. Arna.
Thank you very much. Protect your breast, be self aware.
Okay, bye bye.